Welcome everyone virtually to ODI here in London, broadcasted from my living room, as we all got used to in the last few months. My name is Marta Foresti. I'm the director of ODI Europe, and at ODI we are especially delighted to welcome all of you for this very special event today on Africa beyond and with COVID-19. We've organized this event in partnership with our friends and partners of the European Think Tank Group, which is a network of European leading think tank on sustainable development and international cooperation. And we believe that we are organizing this event and this conversation at a very timely moment in this rather eventful year of 2020. We'll come in a minute to why this year has been so eventful, but as it happens, 2020 marks the 60th birthday of ODI, so it's our 60th anniversary. And so we are celebrating this milestone, the landmark in our history, by organizing a series of online conversation to address the issues of the world post and with COVID, what the new normal will look like, and the global reset that will be needed to learn from these experiences and to work towards more sustainable and equitable societies and economies. 2020 is also a year that started with a lot of emphasis and conversations on a renewed enthusiasm for partnerships between Africa and Europe, very much seen as one of the key priorities of the new European Commission, launched at the beginning of this year, and fast forward with everything that's happened in between and since the beginning of 2020 to what's ahead of us in the autumn, working towards a pretty important and strategic summit between the European Union and the African Union. So we began to think about how to contribute to this process, and in the lead up to the summit, we realized that so much of the conversations about the relationship between Africa and Europe started with the partnership that Europe really wanted and the commitment to partnerships of equal. And so many events and conversations were revolving around these issues. Well, today we want to have a conversation about Africa to begin with, and to really reset a little bit our attention to the variety of experiences and realities on the African continent, and really place the questions about the future relationship between Africa and its international partners, not just with Europe, but globally. And of course, we do all this in light and with the experience and looking ahead at the impact of the COVID pandemic. And when it comes to COVID and what's happening in Africa in relation to the COVID, what's happening in Africa with COVID, how bad or how good the response has been and what to expect. I think there is a very lively debate out there, typically led by numbers and estimates about whether we can be optimistic and pessimistic about how fast COVID will spread across the continent. Today, we don't want to join that conversation. We want to have a rather different conversation, also learning a little bit the lessons from this country, the UK, and many other European countries, of how different the experiences of countries have been in terms of responding to the pandemic, how wrong some of the estimates have been in terms of the speed of infection, and what was best to do to limit the spread of the disease. And so we actually are very interested to discuss a little bit more what's happening in different African countries, very aware of the fact that those experiences are likely to be very different countries, but also to learn from those who are on the ground dealing day in and day out with this reality on the decisions that are being made, the political dynamics behind different models of response. And so really plays that conversation about Africa and COVID much more in the specific context at the country and even at the subnational level. We'll then also want to discuss the other big topic that everybody's interested in, which of course was going to happen next. We know still very little about what's going to happen overall to the evolution of the pandemic and this disease, but there is no doubt that there are great challenges for all of us ahead when we'll come to the so-called recovery. And a lot of it, and rightly, and the emphasis is placed on the economic impact of COVID, but it's also very important to bear in mind how some of the political dynamics are going to change in the world in the months to come. And so we want to look at the prospects for the recovery in Africa, both from an economic and from a political perspective. And we thought we'd do this with a lineup of speakers who know what's happening on the ground from different parts of the continent, from different countries, who had direct experience now in the past of working in a range of different countries in Africa. As you know, from the messages that you received, you can see on the chat, we are experiencing some technical problems. In particular, there is a power cut in Freetown, in Cape Town, that we are trying to address, and so we will have to slightly adapt and change a little bit the order of interventions for this meeting. But I'll still introduce now the panel that we've got today online, or we soon have online in full. Let me begin with colleagues who are able to be on the line right now. We have Nick Westcott, who is currently the director of the Royal African Society, but formerly also British ambassador to Ghana, Cote d'Ivoire, Burkina Faso, Togo, and Niger, as well as a senior official in the European External Action Services. So someone who's had direct experience of working in a range of African countries, interesting both Francophone and Anglophone Africa, which I think is one of the many dimensions that will matter in the diplomatic relationships ahead. We also are lucky to have with us David Pilling, who is, of course, the Africa editor of the Financial Times. And David has been one of the journalists that fairly early on has mentioned and raised issues that perhaps the way African countries were responding and experiencing the COVID pandemic was not the way we were all assuming, and that it required some attention in relation to the different experience of different countries from Ethiopia and others. And he will help us frame these questions about how COVID is having an impact in different parts of the continent. Our two keynote speakers are Yvonne Akisoyer, who will join us very shortly, who is the mayor of Freetown in Sierra Leone, but who also led the Ebola response from Sierra Leone, and has at the moment a real commitment and engagement internationally on working with other mayors in Europe and beyond on issues that matter to the continent as a whole, and really sort of showing how local leadership can be an interesting way of rethinking the way international cooperation and global cooperation will work in the future. And finally, hoping that the power cuts will be resolved soon, Carlos Lopez, who is the High Representative of African Union, European Union relation, and the chairperson to the Commission of the African Union right now, but was also the Executive Secretary of UNECA and worked as a senior official in the UN, and who has been writing extensively recently about the impact of COVID on the African continent, and also calling for new and different ways of engaging internationally with different actors, specifically on the economic impact, and we'll come back to that in a minute. We're delighted to have so many of you online today. You will be key participants in these discussions, and we'll ask you to adapt with us to the necessity to react to these slight technical problems we're having. But we are planning to have at least 2 rounds of questions from all of you in the audience, so please submit your questions through the chat, and we will do our best to respond to at least some of them during the conversation. We're also taking a poll, a bit of an opinion poll of how you all feel about what the priorities for the recovery, specifically in Africa, should be. I think it's fair to say that there are lots of calls out there for all sorts of measures that should be taken, from debt relief. I'm following very closely debate, for example, on the likely impact on remittances, and a lot could be done there. So we want to know from you what you think the priorities should be. You have 4 choices: social protection and health systems, debt relief and economic stimulus, digitalization, new technology, trade and investment. Obviously, we know that all of these matters, but we want to push you all to give us a sense of what you think the absolute priorities should be. So you can vote in this polling, and we'll read out towards the end what you think and whether your opinions will change as the conversation evolves. So while we wait for Mayor Aki to join us and to really give us a sense of the situation on the ground in Freetown in Sierra Leone, David, let me ask you first to share with us your own experiences, from your own reporting in the last few weeks, in the last few months, on the response to COVID in different African countries, and as much as possible, give us a sense of how that differs from country to country.
Sure. Okay. Well, I feel slightly guilty. Thanks very much for inviting me, first of all. I feel slightly guilty talking about the situation in Africa on the ground for a number of reasons. One, of course, is Africa is 54, 55 different countries, and I think the way I answer will sort of reflect that. But more importantly, I'm stuck in West Acton in my kitchen. That is where I've done all my reporting from. So I think you should bear anything I say. You should bear that in mind. I mean, all my reporting has really been, on the phone via video conferences, and I have done a huge amount. Calling dozens and dozens and dozens of people over the last few months. But I'm not there. So we need to be very clear about that. In terms of response on the ground, I think it might be useful to kind of look at this in separate sort of buckets of countries. If you go from the top, this doesn't necessarily mean the best, by the way, but if you go from the top, I would mention South Africa. South Africa really has gone for what you might call, a full European, not even US, but full European style lockdown, together with a massive stimulus package of something like 10% of GDP. So, I mean, South Africa's kind of early decisive action led by Cyril Ramaphosa looks, quite like some of the actions that you had in Europe. I mean, with some important differences. One, it came earlier. I mean, in terms of on the curve, when Ramaphosa announced the lockdown, that was before there had been a single death in South Africa. It was a very strict lockdown. There was a ban on the sale of alcohol, and they immediately, insofar as they could, began a testing program. There were these mobile testing units going around the country. So this was a very sort of strong, severe lockdown, with all sorts, of course, of corollaries, some of them negative: police brutality, people stuck in, housing, without necessarily kind of access to what they needed. I think South Africa, probably running water is generally not a problem, though I'm sure there were people for whom even that was a problem in some of the worst areas of the townships. But this was, as I say, a kind of a European style lockdown in the South African very mixed and sort of bifurcated setting, which is obviously is a legacy of apartheid. Then I think if you've got another group of countries, countries like Ghana, Kenya. I was speaking to the Prime Minister in Guinea, Conakry, the other day. Senegal. These are countries that I would say, Uganda would be another one, I think, that falls into this box, that have sort of, they've acted quite aggressively, often short of full lockdown. It might be a lockdown in particular cities. It might be bans on transport between different areas in the country. It might be curfews at night, social distancing measures, closing schools, places of worship, social messaging. And some of this, and I'm sure Yvonne will talk much more eloquently and knowledgeably about this than I have, but some of this informed by the experiences with epidemics, particularly the Ebola epidemic, which of course struck West Africa and Central Africa, principally DRC, at various stages. So, for example, the Veronica bucket, which I think was invented in Ghana, is a simple bucket that allows people to wash hands in the absence of necessarily, easy access to running water, which can be put outside shops or homes or offices, so that people can wash their hands and take those hygienic messages, which are very easy to to talk about, but not easy to actually implement if you don't have the means to implement them. So these are the kind of hodgepodge measures. But when I say hodgepodge, I don't necessarily mean not thought through. Very much thought through in many cases, and kind of adapted to the realities on the ground, where people took the view that a full lockdown was just too much and was going to be too severe on people who needed to go out and earn a living every day. Now, Ethiopia, I put in a kind of a third bucket. They really took the view that a lockdown itself was impossible in the Ethiopian context, that they had really no ventilators to speak about. Whether it's a few dozen or a few hundred, this is way short of what would be needed if the epidemic got out of control. So they decided they needed to take early interventions within their power. So what they did was they first of all, they were very, although they allowed flights to keep coming in from China and other parts of the world, they were very quick to screen at airports and contact trace anybody who had symptoms or reported fevers. Now, this is not perfect, but they decided not to let the kind of perfect be an enemy of what they actually could do. So although maybe some cases could slip through the net, that kind of system would certainly catch other cases. And you'll have seen that the epidemic was quite slow to get going in Ethiopia. Now, it is true that for all the countries I've spoken about, well, they had early successes and sort of clamped down on the numbers very early on. In the last few weeks and even days, we have seen quite worrying kind of acceleration of the number of cases. But I think we ought to talk about those early stages because they are important. So what they did, for example, they used the system of health posts, thousands and thousands of health posts around the country that had been really built for very basic healthcare, for maternal healthcare, for child healthcare, under Meles Zenawi and his health minister, of course, Dr. Tedros, now head of the WHO. And they sort of switched that on. They went house to house. They asked people if they had high temperatures, if they'd traveled anywhere, if they'd come into contact with people who'd traveled. And according to them, it's very hard for me to verify, but according to them, they went to 11 million houses and, screened in a sort of very rudimentary fashion, but nonetheless screened 40 million people. And originally, anyway, this was quite effective, and they had, deaths in the 20s or 30s. And when I was speaking to them a couple of weeks ago, cases, I think about 350. That has now accelerated. They now have more like 3,500 cases. Although we should stress that this is partly a function of more testing. And as Dr. Nkengasong at the Africa CDC says, if you test, you will find. The fourth bucket, and sorry I've spoken so long, but the fourth bucket, I would put in countries like Burundi and Tanzania, which have really kind of almost denied that this thing exists. John Magufuli, the president of Tanzania, said God would take care of all of this. He then promptly disappeared to his village. We haven't really heard much from him since. The numbers that are coming out of Tanzania are not really credible. There's many reports that there are far more deaths than are being reported. Burundi was practically the same. They pushed ahead with an election, and that the rallies in that election may indeed have been a kind of focus of spreading the virus. We don't know because there are no reliable numbers coming out of Burundi. We do know that Pierre Nkurunziza is dead. There's lots of rumors that he may have died of COVID itself, which would make him the first head of state to die. That's not really provable, but a number of diplomats citing medical sources say that is true, and that there are also members of his family who have COVID. So those are examples, I would say, of countries that have basically kind of denied that this is going on and have let it get out of control. But in the African context, they are the minority, and most countries have taken this seriously and enacted measures within their ability and scope to do so.
Thank you, David. And actually, is very helpful to get this overview of country. Also very useful to categorize, the different experiences of countries, which I'm sure you can, one can recognize across the world, from countries that have denied the problem existence to those who have acted swiftly and early. This theme of to work with what you've got, and to the perfect being the enemy of the good, and the importance of adaptation, seems to me an absolutely key aspect of this debate. It's something that actually David Nabarro on an event earlier on here at ODI really advocated for and pushed in terms of how we're going to have to adapt and live with the virus. And so the importance of actually learning from this variety of experiences from different African countries seems to me as important, if not more important, than continuously to try to come to definitive estimates about the rate of infections across the continent. So Mayor Akisoyer, welcome to ODI virtually. I'm sure, and I hope there will be many opportunities soon to meet in person. In fact, we might. We are working together on a really exciting initiative that sees mayors across Europe and Africa working together on issues of mobility in the months to come. I introduced you briefly earlier on, and I mentioned to everyone your role in the Ebola response, but also your leadership as a mayor with a number of other cities coming together to think about how local government and cities government can really help rethink, redefine, innovate, and adapt to address global challenges, including COVID. So can you give us a sense about the situation in Freetown right now, how the COVID, how the COVID response is evolving? I know there have always been some riots and some violence a few weeks back. So give us a sense about what's happening now in the city that you so expertly lead.
Thank you very much, and it's great to be on. I mean, it's been interesting what one of the things clearly this outbreak has done has just to open up platforms for sharing information much more easily with all of these Zoom calls and broadcasts. And it was interesting to listen earlier on to the thoughts about what's going on in other countries on the continent. You can find yourself so focused on your own situation that outside of those other mayors that you're connected with directly, you can very easily lose sight of some of the other innovations that are happening. So what's going on in Freetown? We're the epicenter of the outbreak. We are still at a place, and I actually just said to someone this morning, I feel uncomfortable with where we are. We've got just north of 1,000 cases now, 600 or so in Freetown, 1,000 cases nationwide, 600 plus in Freetown. And I think that when I look at Pakistan and India and the way that they started quite gradually, and now they found themselves in a position where their health facilities, their health system is really struggling. That's precisely where we do not want to get to. The response in Freetown, the response in Sierra Leone is being led by the national government. And again, one of the questions that you had in this document speaks to the role of local governments, and I think it's worth actually just taking a moment to talk about those dynamics. We're seeing them playing out across the globe in different continents. I mean, very famously, we see the tensions between the US presidential sort of view of what should be happening in the response and what's happening at state and city levels, with many mayors behaving or taking a different line. And here in Sierra Leone, it's not as dramatic. It's not dramatic at all. Let me just sort of like rephrase that. But we do have a situation where the government is leading the response, and what cities are able to do is to play a complementary role and to try and find a space where they add value. as opposed to being in a position. And that really stems from our governance structures, where things like, the major hospitals, and therefore testing and so forth, are centralized. So, the role you can play is a role of collaboration, as best as that's possible, and then fill in gaps where you see. So the Freetown City Council's COVID preparedness and response plan is a plan that speaks to the areas in the response where we believe we can add value without being in leadership. Because we can't be in leadership and testing. We can share ideas, we can put forward suggestions, but where we can play a lead role, where we can actually add value, is where our plan is focused. So it's got 3 strategic elements: behavior change, messaging, behavior change support, and isolation and containment support. And stepping back out of the Freetown context just for a minute and speaking about one of the features which is so prevalent across African countries, and that feature is informality. So it is this informality, whether it's informality in housing or in transport or in the employment sector, it is this informality which is fairly unique. Well, no, it's not unique. We have informality in Asia and Latin America, but it's really prevalent in a city like ours, in Freetown. And so in crafting out the city's response plan, the city is looking to see what it is that we can do in the context of informality to, at the start of the discourse, really try to get people to understand what COVID is and to respond. There were a lot of comments, and this morning on radio there was a review of a CAP survey that's done that has highlighted. I mean, it is a few weeks out now. It was dated April. The work was done in April, but it showed that 35% of Freetonians do not feel that COVID is, or keeping themselves safe from COVID is more important than them being able to address their economic challenges. And that sort of number creates a real challenge. And it was interesting because it's not so much that is the message out there. Reference was made of Burundi and Tanzania and a sort of a governmental denial. At the individual level, you also have a question of choice, and that decision about, yes, I hear the message about Corona. Do I believe it? That decision to believe or not to believe, and what flows from there in terms of your behaviors and consequently in terms of the transmission chain is really significant. And that's where we're trying to put a lot of energy. But I'm also recognizing increasingly that, there are limits to what can be done about sharing a message in a context where you aren't fully in control about the exercise of the response, and because these things speak to each other. Believing a message is all about trust, and trust is as much about experience as it is about perception. And so, within the context of the national response, there are areas which were talked about on the radio this morning. And again, this might be something that other people are experiencing in other parts of Africa, where there isn't a consistency necessarily in application of enforcement, whether it's about mask wearing or bars respecting the curfew, people traveling into district when there's an inter-district lockdown. So in Freetown, the Freetown City Council's response is focusing in on that messaging, on building trust, and trying to get to a point where, and it's not an easy task, and it's one which cannot be done without collaboration with the central government. So this is something that is a work in progress. But as we think about the saving of lives, and in the context of opposition mayors and sort of central governments, there is a place where there's a piece where one has to say the only solution, the only answer is collaboration between the central government and the local government. And I think that's a really important message coming out of this experience for us in here in Sierra Leone. The second element is around behavior change support. And again, our informality is at the heart of this. Mention was made of the Veronica bucket. And the Veronica bucket has taken on new designs, and we've seen innovations where there's versions now where you don't need to actually touch the bucket. The pedal releases the soap, releases the water, and that's been quite sort of a sidebar on this. It's just seeing the innovation that's come through. We have support that we're giving in because of this lack of access to running water. We're introducing in a number of our informal settlements, and we're actually earmarked 68. We're introducing rainwater harvesting. A very simple solution to make water more accessible. But the masks is another key piece. Local production, jobs for tailors, but at the same time, we have a very important piece around, again, this question of belief and trust. So Freetown City Council has launched a Mask Up campaign, and we're looking to provide masks for 120,000 people for free. So targeting our informal settlements, but most importantly, our market women who are very vulnerable and in the front line, commercial drivers. And I've just been reminded, actually, the drivers union president just called me to say, we haven't received the masks yet, just before I came out to this call. So that needs to be fixed. But also persons with disabilities. So really the vulnerable groups. And 120,000 represents 10% of the city's population. In isolation and containment support, which is the third element, we are coming alongside central government and providing community care centers for asymptomatic people who live in informal settlements, because we don't have the luxury of space in those settings for home isolation and home treatment. This is what's going on in Freetown, and I think the economic impact, which can't be ignored, is really being strongly felt. And yet, at the same time, we've also found ourselves in a situation where, as a city, we have gone ahead with the rollout of a new property rate reform system, which means that we're asking citizens to actually pay rates in this difficult time of COVID. But we've had to make a choice between creating another crisis in a crisis in a crisis, or recognizing that even in the midst of the challenge that is COVID, and to this point about living with COVID, that we can't just let everything go. It's been a challenging time, but it's one where we've learned. We have fast-tracked elements of Transform Freetown. We've put other things on the back burner. I've seen personally more clearly the extent of vulnerabilities, particularly of women within communities. And it's something that we are determined as a city to ensure that, using the cliche that's around now, we build back better. We haven't locked down. There have been lots of conversations at the national level about a lockdown. We've had 3-day lockdowns twice, but there hasn't been that sort of consistent 14-day or longer situation. And I'm glad there hasn't been, because I know our situation and our circumstances are such that more people are dying still from malaria than they are from COVID. Not that we want to joke with COVID. Clearly, it has the potential to far surpass malaria deaths very quickly. But we need to take things within our context and ensure that we don't aggravate already life-threatening situations in trying to address this. We have to find a way to live with this. And I'm conscious that I've probably gone over time, so I'm going to wrap up now, but I wanted to say a quick word on social distancing and marketplaces, where we've seen lots of pretty pictures of markets, open markets with, people with, sort of 2-meter distances between them. We've spent a considerable time, effort, and resource to try and experiment with this in one market with 2,045 traders. The indoor market only takes 159 of them, so they're all on the street. You're contending with cars, you're contending with commercial vehicles, you're contending with house owners. In a city with a density of 845,000 people per square kilometer, you need to address your reality. And our reality is that we cannot overnight create the lovely sorts of scenes we see in other places where people are standing in their circles and leaving a space between them. So much more emphasis on wearing masks, much more emphasis on people washing their hands, and on building trust so that individuals, and we're not there yet, so I say this knowing that we've got a long way to go, but building trust so that individuals believe that they can take action, which at least on a physical level, through the hand washing, through the distancing where possible, and through the mask wearing, where they can break the chain of transmission. Thank you.
Thank you very much, Mayra Kisoyer. And we'll go in a minute there are some questions coming in from our audience that we'll definitely address. But can I ask you, before we go there, because you mentioned a number of really, I think, important and interesting things, including these issues of the role between central government and local government, including, and some of the limitations that local policymakers have in a response of this kind, even when the phenomena itself interests and affects cities much more so than other parts of the country. And it's been true it's been true across the globe. And navigating that relationship of different levels of government is key. And to me, it's a very interesting questions about the future when we think about new models of international cooperation and the breakdown of global leadership in this. How we're going to create meaningful ways of engaging networks of local politicians and policymakers that have had these experiences in managing response and adaptation and innovation. But specifically on these issues of behavior and trust, which I think is been so key in so many countries and so difficult to get right. Much has been said about what has been learned from the Ebola crisis. In your own experience on getting people to building that trust and encouraging people with actions that can build on that trust to do things differently. How much of your experience in your messaging that you mentioned and on what you're doing now with the citizens of Freetown comes from your experience with the Ebola response? What have you learned from that you carried into this crisis?
So I often talk about 4 lessons. I mean, everybody's Ebola experience was personal. There are many fighters in that war, and therefore a multitude of lessons. But I speak of 4, which will always stay with me. The first one is the importance of command and control. Having really clear structures for managing information and reporting lines nationally, in cities, in communities. The second is community ownership. And that's what we've been speaking about in relation to the messaging and the trust. And it's getting to that point, and we certainly are not there yet in Freetown, where there is an ownership of this crisis as being, and a sense in which community leaders, significant influencers, school children, are seeing this as their fight. And that really needs trust, and that needs engagement, it needs information, and actually, to a certain extent, it needs time. And where you've had situations, which is our reality here in Freetown, where there's been a lot of dramatic occurrences. You mentioned the riots. I'm sure perhaps you're aware of recent statements, arrests, court cases, etc. It's very hard. It's very hard to bring everybody along when there's so much background noise going on. But that notwithstanding, it's critical for the outbreak to be overcome, for there to be that sense, to a degree, it's never going to be 100%, but that sense of we're in this together. And then the next is closing the gap between protocols and practice. And that's so important. I mentioned earlier on experience. The people's sense of trust is often grounded, inevitably, in experience. So if what you say happens in a response, if you tell people call 117 and you will have a response, if you're not feeling well, or if there's something as like a corpse on the road, and people call 117 for 2 days and nobody turns up, you will lose trust. And that doesn't help with community engagement. So closing that gap, and I think there's a ways to go. And this is what I talked about when I said there's only so much that one can do within our context in the local arena, because there are elements of this response which are only ever, which are in the hands of the national response. And then the fourth one is what we've heard so many times. It's test, trace, isolate, contain the virus. And again, your ability to do that is really key to the trust. It's really key. It's part of your protocols, and it's also influenced by your command and control structure. So those are my experiences. They have fed into the plans that we have at the city level, and I continue to share with others. And this is a journey. I'm not here pointing fingers at central government. It's a tough job to get this right. I really do hope that the community engagement piece, appreciation of the need for us to reduce the background noise and focus on the outbreak, I really hope that message gets across.
Thank you very much, Mayor Aki-Sawyer. I think we still have the technical problems in Cape Town. So for now, we're still waiting to see whether Carlos Lopez can join us. But we have a couple of questions from the audience, and some of them I think are specifically for you, Mayor Aki-Sawyer. And I think I would really like, as we then discuss a little bit the recovery, international cooperation, to go back to this issue of different levels of government on the way forward. Pretty much on these issues, somebody who is anonymous is asking, there is no evidence that decentralization as such can increase effectiveness of governance, and especially of the public investment, unless there is sufficient capacities at the local level. So coherent multi-level governance, I guess good collaboration between different levels of government, and productive interaction at all levels are important. So what do you think about that? It can be both the experience of Sierra Leone, but there's issues about how would one define these capacities that are needed to make local government work effectively. And then perhaps more broadly also for David, the question about whether, and this is obviously something that is, we're all wondering in different parts of the world, but whether as we think about the response and the way forward, we can address the challenges beyond those of health and economics factors, but also to address some of the pre-existing socioeconomic issues and inequality and employment that have made some of the experience of COVID so challenging. Which, what do you think of African countries having an appetite, I guess, political will and incentives as well as capacity to do that? Finally, a question about data. In the case here about projections around COVID having not worked out, and the fact that we have limited data, I would say that also in countries where there is plenty of data, some of the projections have not worked out that well either. And whether this is because we asked the wrong questions, or wrongly framed, but a question fundamentally about whether going forward we can hope that across African countries we will make some serious investment into improving the quality of data on health and beyond. I don't know, maybe David, do you want to start with the question on on an opportunity to sort of to address issues beyond health and economics, which is something that when Carlos Lopez joins, I'm sure he will also want to comment. And please, Meira Kisoya and Nick, feel free to comment on all those questions.
It's certainly an opportunity, but I'm quite skeptical as to whether it will be an opportunity that's taken. I mean, it's clear that COVID, all around the world has been like an X-ray, and it sort of shows in a flash, to some extent, what's wrong with your societies. In Britain and around the world, we see that key workers, the people who make the economy work, who keep us healthy, are people who are, badly paid, who are liable to have bad health outcomes themselves, who are often in Britain ethnic minorities, etc. Now, whether that's going to galvanize the government to do something about it afterwards, I have a certain skepticism. I mean, a political momentum may build. Now, if you transpose that to Africa and to African countries, the same is true. I mean, COVID has exposed, for example, in South Africa, the very different conditions that the black majority and the white minority live in, and therefore the conditions that prevail during a lockdown. But if anyone didn't know that before COVID, they hadn't really been looking hard enough. In some countries, we've seen that the security services are not everything that we might want. There was a stage in Kenya where, more people had been shot by the security services imposing curfew than had died during COVID. Now, one can say, therefore, it becomes very obvious that one should do something about that. But will government seize on that opportunity thereafter? Health services were obviously very much exposed. We ran stories about the lack of ventilators all around the continent and the lack of IC units. Now, I think to some extent, that's a bit of a red herring. I think the battle will be fought sort of further down the health system, tracking and tracing and trying to prevent people reaching IC units in the first place. But still, the health systems of countries have been, exposed for what they are by this. But post-COVID, will elites continue to leave their countries and seek healthcare abroad as they have done before, and kind of leave the population to get on with it? This is in the worst governments. Not all governments are as bad as I'm kind of caricaturing in that sense. Again, one would hope so, but will they? I think the final point in my sort of slightly skeptical answer is that for a year or two, governments will be in less of a position to have national plans and mobilize public resources to put in place the public goods that I think, are the kind of foundation of any sort of functioning democracy and functioning country and development state, whatever countries choose to be, because they'll be cash strapped, because these economies will be hit very hard by this. The continent as a whole is set to have its first continental-wide recession in 25 years. Economies that rely on commodities such as oil will be even more severely hit. Even economies like Ethiopia supposedly will grow at 3% this year. We'll see that. I'll believe it when I see it. But even if that's true, that's a 7 percentage point fall on at least stated official GDP growth in recent years. That's a hell of a hit to take. So to expect governments to do more with less is to really kind of be forecasting a concentration of mind and a concentration of policy and a concentration of leadership that I would absolutely love to believe will result. But I think I'll believe it when I see it.
Great, David, and I really hope that we'll be able to, at least if for any reasons Carlos will not manage to join us in person, this is a question and an argument that we need the two of you to find a way to have, perhaps with, a blog or something, because I think how do we, what can be done about this reality you just outlined about the inevitable economic impact that we will all experience in the next few years, and specifically what can be the role of international community to support and incentivize recovery in ways that can actually work, given everything that's been learned and done that Mayor Akisoya and others have outlined. On this question then on what will make decentralization effective, your experiences perhaps, Mayor Akisoya, and then Nick briefly will bring you in on data, and then we'll carry on talking a little bit about the future international relations between Africa and other partners. Mayor Akisoya.
Well, I think I have a really simple example. You're saying, is there capacity at the local level? Well, there's capacity where there's investment. And if I take myself, or if I take my city as an example, we're now in the middle of June. The budget for 2020, the fiscal transfer from the central government to Freetown City Council has yet to be disbursed. We've not received a single leone, and we're halfway through the year. So these questions of capacity, the grass is greener where you invest in it, where it's watered. We are people, right? Institutions are made up of people, of structures, etc. If investments are made at the local level, then you will get, capacity at the local level. If investments are not made, you won't have capacity. So I think it's a decision about what we see as the most effective governance structures for the delivery of services to the residents of a city or of a local authority or of a district. I am a firm believer in decentralization. I'm a firm believer that you do see an improvement in service outcomes, in governance outcomes, where you decentralize, but decentralizing without budget, without support, and then turning around and saying there's no capacity is a nice way to sort of get out of something, which, if you were focused on what we want to see to bring development, you wouldn't be saying. I think, my view. Thanks.
There is also a quick follow-up question still for you about how closely you've been working with the private sector in Freetown, and whether there is anything the international community can do to facilitate that relationship. And this question is from Paul Vakarkara from ECDPM in the Netherlands. And I forgot to mention earlier, apologies, that the questions that David responded to was from Nazreen, who works with Surge Africa in Nigeria. So the private sector, Mayor Yvonne, how important it is in Freetown right now, and how much better could it get?
Right. So we've had engagement with the private sector early out in the outbreak. We had some calls with the Chamber of Commerce, with the Sierra Leone Chamber of Commerce, which have resulted, actually, let me just remember this, we resulted now with the Chamber of Commerce actually supporting one of our interventions, supporting us with the provision of supplementary food for quarantine homes. So that's a very specific example. In a more general level, a number of companies, banks, etc., private sector firms have looked at the FCC plan and have said, okay, we'd like to support you with this, we'll support you with that. So there has been collaboration with the private sector. But I think we also have to remember that the private sector is being really hard hit at this time. What we see is them being responsible Freetonians and wanting to contribute to what's going on in their city. But I think at this point in time, people are looking at their bottom line and they're considering what's going to be coming down the road. So yes, there's been collaboration, and I really thank the private sector for it. It hasn't been huge, but I think that makes a lot of sense from their perspective as well. We're getting on with support. We're reaching out for support. From our perspective, it would be just as well for them to be strong enough to meet their responsibilities, their fiscal responsibilities to the city, property rate, business license, and support in that way. And what social corporate responsibility they can chip in will be appreciated. But we also really care about our private sector in the city, and we know that this is a difficult time for them. So it's not a time where we're wanting to sort of add the pressure. They're doing a great job. Thanks.
Thank you very much, Meraki Sawyer. So, Nick, you wanted to come in on the question on data, and then I'll pick up questions with you again, looking for the future of international cooperation.
Thank you, Marta. A very quick point that accurate data are very hard to get anywhere. We even find this in the UK, that although the official level of COVID deaths is 40,000, the real level of excess deaths is around 60,000, we know from the statistical office, even more so in Africa. They do say that if you want a real picture of the COVID death rate, you ask the grave diggers. Death doesn't lie, it happens, and they know how many have died. And this is true throughout Africa as well, that you can't actually hide the truth of COVID. And those countries which have denied that it exists or it's a problem soon find out that their ministers start dying, or their president dies, or all their truck drivers are stopped at the border between Tanzania and Kenya because they test positive. And those governments that are used to perhaps not telling their citizens the whole truth are exposed, and their citizens will know that. And it doesn't, as the mayor has said, doesn't actually increase their trust in levels of government. And as David has said, COVID pandemic is a stress test for governments. It holds up a mirror, but it tests them. And those governments that are used to responding in an authoritarian way quite soon find that you can't solve the pandemic through the police. You actually need a health system to cure it. And the people will see this. So the longer you try and deceive, repress, the worse the situation will become. And because the primary impact in Africa is actually economic, if it goes on for very long in that way, you don't build the trust of communities, your governments will find themselves with a lot of very unemployed and very unhappy young people. And that will precipitate more rapid political change. Thanks.
Thank you, Nick. And we are back to trust and the importance of trust, not just in relation to the response and behavior change and the fact that people needed to adapt to protect themselves and others from the virus, but it's actually fundamental in the recovery process and in sort of building this concept of building back better. At this point, I would have asked Carlos to discuss with us a little bit his views about how important, so switching a little bit the emphasis now to the future, the months to come, and the recovery, which I think, as we're all already discussing, is not a phase 2, but rather is an evolution, a continuation of adapting to the reality of COVID and changing our economies and societies. So in this new normal, in this recovery process, how central will the relationship between Africa as a whole, and we've already, we started the meeting saying how important it is to actually discuss in much more detail the reality of the different countries in Africa with Europe, and again, with different parts of Europe. So let me ask you, Nick, first, and others later can also contribute. Tell us, where do you see this relationship going in the future? There's definitely been great expectation, a certain amount of political investment from the European Commission and the new and Ursula von der Leyen in building a more equal, partnership of equal with Africa. How much of that feeling is shared in different African countries, and how crucial is Europe is as the partner of choice for the future? And does that vary in different countries, and especially those where you've had experiences as an ambassador?
Thanks very much, Marta. In the same way as for domestic situation, the international situation, the pandemic, is a stress test for relations between Africa and the rest of the world. In fact, it arrives in the middle of something of a struggle for influence in Africa that's going on, in which Africans will decide, but nevertheless there is a jostling for that influence by outside partners. The COVID pandemic is unusual in that Africa has usually found itself at the center of the epicenter of the epidemic. In this occasion, it's not. It's a relatively peripheral part of the health problem by comparison with first China and then Europe, now the US and Brazil. But it is at the epicenter of the economic impact. And the economic impact has been deep and profound, and it's where the relations with the rest of the world are going to be absolutely critical for trying to restructure it, or, if you like, the African response to the fact that they have been so badly impacted by the downturn in the rest of the world. Will they start turning in and saying, actually, we Africans have to find our own economic solution to this, and becoming more autonomous? That's the kind of question that we're going to address. There's been huge vulnerability to the economic fallout because it's impacted on markets. Prices have fallen precipitously, particularly for oil. Transport cut off means a lot of horticultural products haven't been able to get to Europe. Remittances have fallen equally dramatically, 20 to 50%, some people say. Capital was initially withdrawn, though it's beginning to come back. David knows more about that, but people are beginning to reinvest a bit. And agriculture has been a real problem because food supplies have been put at risk both by the local response and international transport. There have been a lot of positive responses to that, including the digital response in Africa, but the international response has been very telling. China, as we know, has been a growing presence over the past decade, increasing influence, initially economic, but increasingly they've wanted to turn that into political influence. But their response to COVID has been more gesture politics than substance. Jack Ma sends a lot of masks and PPE, but China is not forgiving anyone any debts. You might get a little bit of a holiday, but the debt is still going to be there. The US, the other major player, has been huge in responding to the HIV epidemic and Ebola, are nowhere to be seen. On the contrary, they've been withdrawing their funding from WHO, which is not only in some ways an insult to Africa, given it's the main UN agency headed by an African, but the WHO is central to Africa being able to manage and effectively mobilize the health response. So no thanks to the US for its response to this crisis, and that is rather representative of its place in the level of priorities of the present administration. The EU has been very active and has stepped up. And in some ways, this is an area where Africa is finding who is its friend in need. And the EU has contributed substantially and specifically, both on the health side and in delivering budget support quickly to provide that kind of liquidity for a number of African countries. COVID has put the EU under stress test, and it's very focused on its internal problems. But even so, it has found time to maintain its support for Africa, not just in the health area, but across the board. The international financial institutions, World Bank, IMF, again, have actually been very constructive and tried to respond as flexibly and as quickly as possible. There is a big issue about special drawing rights. It's a bit technical, and that still needs to be resolved. But by and large, the international financial institutions have stepped up. The World Bank, the IMF, African Development Bank, they have been there. The UK is an interesting case. It has been in some ways a bit part player. It is still doing a great deal. DFID, who are about to be absorbed into the Foreign Office, which unfortunately sends a rather downbeat signal as to the prioritization of development for this government. But DFID has remained very active and making a very constructive contribution. But it's a bit sort of, the government is not saying anything about it. It's a bit embarrassed, and therefore there's very little coverage. Other countries that have an interest in Africa are also stepping up, but very much from their own individual interests. The Gulf countries have become major players in the Horn of Africa, and they're looking for opportunities to buy up distressed assets, move more into the transport sector, aviation, ports. But this is entirely from their interests. And therefore, while you accept the gift, you maybe look the gift horse in the mouth to see what's lying behind it. And interestingly, South-South cooperation has been almost invisible. Brazil, India, others are not really in a position to give Africa the help that it needs at this time. What has emerged from this then, in its relations, is that Africa has its most positive relationship with actually the multilateral institutions. It's the UN, it's the IFIs, it's the EU that are stepping up and helping Africa at this time. And there's a question whether Africa realizes that actually it wants to preserve these international institutions because they will help protect it when it needs protection. It is in many ways the most vulnerable continent. It has the least resources. It can't pay people to go on furlough. It can't prop up its national airlines. We see this in South Africa. The cash is not there. So they have to find other solutions and take the help where they can. But they're going to be able to operate most effectively in that international environment when they cooperate amongst themselves. There's been very good cooperation on the health side across Africa, and it's a big question whether they will continue that on the economic side. Will we see the continental free trade area being pushed forward or just being put on hold, put on a shelf? We don't know yet, but that's the sort of question that we're asking. In these circumstances, Africa needs to create more autonomous economic growth, not wholly dependent on global markets, if it's to provide a future for these young people that I was referring to before. That's really the sort of question I'm looking at Africa to find an answer to. The international community will help, but the answer is still in African hands.
Thank you, Nick. This couldn't be more comprehensive and clearer, and I'm very tempted to go straight to Meera Kisoya to ask her the extent to which she recognizes that picture from Freetown and Sierra Leone. So this, the multilateral system being the sort of the partner of choice, the one has stepped up. With the EU, others perhaps not as much as expected, and the importance of intra-Africa cooperation as a basis to get more out of these relationships. Do you agree?
From our own personal side, our plan, the response plan that I outlined earlier on, we've received significant funding actually from the EU. We've also received funding from DFID, World Bank, UNCDF, UN Habitat. So to the point that was made by Nick, there's been a stepping up of multilateral players, and the EU has also demonstrated its continued support. And this, I think, significantly is happening at the subnational level. So this is support to the city of Freetown, separate to support that's being given to the national government. But in all of what's said, where we want to get to is not to be that most vulnerable continent, those most vulnerable in any situation, dependent on others to give us handouts. And I know it's a journey. I'm from the private sector. I've been mayor for 2 years. But one of my priorities in becoming mayor was to build the revenue base of my city, which means building our sustainability, our resilience, our ability to create jobs, and therefore to pay our way. As you were talking, Nick, I had a message come into my phone, and I had to turn and look. I said that we had gone ahead with a property rate reform last week in the middle of COVID. I literally was tearful as my team have just sent me photos of people queuing to pay their taxes at the Freetown City Council. And I'm just like, I've written there, I'm choking back tears. Thank you, team. And this is where we want to get to. I mean, this is happening because, we developed it's a mob tax system, so it's digital. The entire city was geo-mapped. Every house was photographed. People who'd never paid property rates before are now paying property rates. But as you pay at the on-site banks in the council, your account is being updated immediately. And that confidence, seeing people do this in the middle of an economic slowdown, is also because as we speak, there are also parts of the city where we are cleaning gutters, we're building drains, we're planting trees. And I never want to simplify anything because nothing is simple in life, but it's really gratifying to see that when people see service delivery, even if you've had to get a kickstart with health help from international partners, it gives you the platform to build trust and to begin to work through how you can be sustainable as a city. COVID as a backdrop is a challenge. Our job creation strategy had been around tourism. a sector which has been very badly hit by COVID. So we're having to go back to the drawing board and understand what this is going to mean for us. What alternative considerations we should give. We've started an urban farming project as part of our COVID response to help our most vulnerable grow their food as opposed to having to go look for their food. And maybe this is something we're going to have to think about more broadly in terms of a tweaking of our job creation strategy. But yeah, thanks.
Thank you. David, let me come to you for a comment on what we just heard. I specifically would be curious to know about what you make of the picture painted by Nick of, in a way, the old and traditional partners coming forward, and in a way the multilateral system as we know it being the one that can be relied upon to respond to the crisis, but also these elements of innovations and these elements of locally led initiatives and specific industries and specific sort of adaptation and response. Some of those you also outlined in the beginning. When it comes to this picture about who is out there that is interested to cooperate and help, so to speak, how do we make the most of these these opportunities? How will the multilateral system be able to support innovation that exists, including at different level?
Well, I'm even though I have occasionally used this framework myself, I'm very uncomfortable with the whole idea of a scramble for Africa or a new scramble for Africa, this kind of big power play, the sort of China and the US fighting their battles out, through the WHO or through the funding of the Africa CDC, or through just rhetoric about who's a better investor and who's a better lender. I find distasteful, really. I mean, Africa and African countries are not a playing field to be played upon. They're countries with their own interests. So I much prefer to look at this thing from the point of view of Africa, insofar as one can talk about the continent as a whole, and through the AU and some of its institutions, and more importantly, African countries and African cities. And I think the story is sort of, it has some positive elements. I mean, there clearly is a lot more interest in Africa, in the last 15, 20 years after the whole debt write-off. Then you had China moving in because China had reached a certain stage of its development and needed resources. But from Africa's point of view, it now has all these sort of choices, because on the back of China, you had Turkey and India and all sorts of others of sort of the Gulf states, as Nick mentioned, have seen opportunities. And African governments and African businesses and African cities, I mean, their job really is, in a sense, to play one off against the other and get the best deal they possibly can. Then, of course, the duty of African citizens is to hold their own governments to account, because you don't want a government, using these opportunities to pocket money for themselves. I mean, the whole point is that this, opens up a potential to attract more investment, to attract more flows of capital into the sort of industries and public services and public goods that are going to drive development. I know there was a question about innovation and youth, and it won't be. I mean, nobody who knows the continent at all well would be remotely surprised to see these sort of incredible innovations going on, all around, whether it be, factories that made one thing being turned into PPE factories, or brewers now producing oxygen, or apps that cleverly can kind of track things, medicines being tested and validated and verified through clever systems. And there's all sorts of incredible innovation going on. And I think what is very important is that it's these innovators, many of whom are young, entrepreneurial, energetic, often optimistic. It should be they who are attracting the capital. And that's both international capital and also domestic capital. I mean, I think it has been quite noticeable that the big conglomerates that have money, the Dangotes, if you like, of this world, generally don't invest in this whole kind of entrepreneurial space and universe. And that really needs to change, because there's so much, there's so many ideas, there's so much energy, and a lot of African solutions are there with African youth who are just desperate to create solutions to tackle these problems and to turn problems into opportunities. That I think is really where the focus should be.
Thank you very much, David. I would like to leave the very final word to Mary Akisoyere in a minute. We're only 4 minutes to go. But given that you've touched on innovation and entrepreneurialism, let me give you now very briefly the results of our polls in terms of what our audience thinks should be the priority for the recovery. And I'm afraid to say that the majority in the region of just below 70% combined believe that a combination of social protection and health system and debt relief and economic stimulus are the two absolute priorities. With digitalization and new technology and trade and investment both at 17% each only. So it is interesting that we are, when we think about the priorities for the future, we, to some extent, perhaps in line with some of the things that Nick was saying about who are the ones who are stepping up, who are the actors, and perhaps these actors, will provide the kind of engagement and packages and assistance that traditionally international sort of communities, international organizations do on the African continent. But I really want to finish on entrepreneurialism and youth. And so the very final question from Ebenezer Obeng Akrofi from Ghana, which I think I would like Mayor, if you're okay, to just give us a final word on, is actually on African youth. And they've proven to be responsive and adaptable to crisis in terms of innovation. What plans can be instituted at the very, at least in, what you can do in Freetown to substantively include youth in the post-COVID recovery phase? And let's make youth the final point of our discussion today.
I think it's a good place to end. Day of the African Child and youth are just a little bit off beyond children. There's a really investment in youth. There's a recognition that education in its traditional form may not be the answer because there's so much catch up to be done. And it was interesting that it was only 17% who thought that digitalization and innovation were important, are going to be important drivers for the future. I actually believe that is where the future lies, and that's what's going to give our youth the best chance of being able to leapfrog and contribute to development. I can see that my connection isn't very good. I hope I'm still being heard.
We can hear you.
Okay, I think I'd like to close on this point that the high rates of unemployment which we currently have with our youth, the failure to invest, and now the challenge where we don't have the sort of levels of energy so that will allow the old type of investment in manufacturing, but also the interface with climate change and the need for us to be conscious of green investments as we go forward, for me means that as we invest in our youth, we should be investing in technology. I just described an innovation in our city, which is really built on technology, but which created jobs for 170 youth who were enumerated as part of that process, training them up, and which will enable them to go on to take up other opportunities which are more technology linked. COVID, as many people have said, has shone a light into where there are frailties, where there are challenges, where there are existing vulnerabilities. I think in addition to shining that light, from a perspective of identifying what the problem is, it is an opportunity to really think through where we want to go next. And for me, investing in youth, investing in technology, investing in the digital age has got to be the way within the context of green economies. And that's true for Africa. Please let's not think that Africa can be thinking about green. We're doing ourselves a disservice if we take that approach. We're planting 1 million trees as we speak.
Thank you, and it's great to finish on youth and trees and technology and innovation, and perhaps is a reflection that as we and others and everybody, tries to to make sure that the international community steps up and continues to be engaged with African partners, that in addition to the fairly traditional way of thinking about the instruments that we have, the different kinds of financial support that is needed, and really tapping into this energy, this youth, this adaptation, those lessons that across the different countries David shared earlier on could be learned to really design, all together in a collective fashion, a recovery process that really is no longer the old normal, and helps us transition to a new normal, including one where we can make the most of the energy and the opportunities that the African continent has always led on. It was a real shame, of course, not to have Carlos Lopez with us today. I think the problems in Cape Town were not resolved, but I was thinking, we'll ask him, of course, but the beauty of this digital engagement is that one can do it in very different ways. So we'll find a way, perhaps with some response and reflections from him on the discussion we had today, to make sure that we'll capture his views. Thank you very much to all of you, the audience. I think there were more than 300 people listening online today, and for your questions and your engagement. But a very special thank to David, Nick, and Mayor Yvonne Sawyer for being with us today, and for sharing so openly and vividly your views and your experiences. Apart from everything else, we'll continue to obviously monitor and engage in the next few months in the recovery process. We will also continue to engage also with partners in ETTG on the EU-Africa Summit. And so there will be more opportunities to continue this conversation in different means, and hopefully we'll meet again. Thank you all very much. Have a lovely day, and hope to see you all very soon. Bye.